Thank you for coming, and thank you for the invitation. So today I'm going to speak about Mediterranean diet, which is very popular dietary pattern in these last 20 years. And these are the main characteristics of the Mediterranean diet. It's a plant-based dietary pattern. Among the main characteristics, we have also olive oil consumption, legumes, nuts consumption, and typically we always speak about red wine consumption, moderate consumption of red wine. Let's look a bit about the statistics on alcohol consumption at European level. As you can see, Italy is among the less consumers of alcohol. This is specifically beer. And as you can see, it's not just about beer, but the consumption of wine is decreasing over time. And the consumption of beer is a bit increasing. And well, this is the percentage of the daily alcohol intake. And about beer, specifically beer, we have about 4.5% of people drinking beer every day. If we look at the specific distribution of alcohol consumption among regions, you can also see that there is a gradient between the north of Italy and the south. In Sicily, we basically drink very few alcohol, not so much. And well, still wine is more consumed, mostly because wine is costing less than beer. So I think the price is a big reason for these differences. So our goal was to evaluate the adherence of Mediterranean diet and how it was affecting the health. So we collected data from a pilot study of about 3,000 people. And well, this was the distribution of the Mediterranean diet. You can see it's quite high adherence. And what about alcohol? Well, this is the distribution of daily consumption of alcohols. And as you can see, well, we found a little bit higher percentage of daily consumption, but very similar to the data reported. And this consumption of alcohol, daily consumption of red wine, and in this case also of beer, was significantly associated with the high adherence to the Mediterranean diet. And as well, yeah, you can see this curve is a J-shaped curve, which is indicating that the amount of grams of alcohol mainly associated with the Mediterranean diet, it's about 12 to 35. Well, these were the results of the effects of the Mediterranean diet. As you can see, we had a decrease of the risk of hypertension, obesity, and diabetes. But what about alcohol? Well, if we look just at the amount of alcohol coming from each beverage or the type of alcohol, as you can see, there are no statistical associations, but there is an association between alcohol consumption and obesity. So who is drinking any type of alcohol was associated with increased risk of obesity. But let's get a look better to the results, because I'm following exactly what we were speaking about before. What I made is to evaluate the alcohol consumption among people more adherent to the Mediterranean diet and less adherent. So as you can see, who was more adherent to the Mediterranean diet was drinking beer daily, the 6.8%, and who was less adherent was 4.1% daily drinking of beer. And the total amount of alcohol was less in who was more adherent to the Mediterranean diet, and higher in those who were less adherent. So what is the meaning? The meaning is that who was more adherent to the Mediterranean diet was having a more regular consumption of beer in this case, but overall the quantity was less. And these were the associations to the disease, health status, and in this case, beer, among the more adherent to the Mediterranean diet, was associated with a decreased risk of hypertension. Instead, in the less adherent, there was not this association, and even a higher increase in diabetes in the end. So, what can be the explanation? Well, lifestyles, as we said before. Who was more adherent was generally older, more physically active, well, more dedicated to gardening or some this kind of activities, and were not smokers. Another explanation could be the alcohol content. Actually, there are a lot of meta-analyses that are demonstrating that overall a moderate intake of alcohol is not harmful, even protecting. In this case, this is about hypertension, so less than 10 grams per day is protective. And these are data on, sorry, can I go back? Yeah. And these are data on cardiovascular disease. And the moderate consumption of alcohol was associated with the less risk of coronary heart disease and partially to stroke. So the evidence is this about alcohol. Let's say that if you will look at the single study, we may have contrasting results, but if you will look at the meta-analysis, we have overall agreement. And maybe, perhaps, the older studies were not taking into account correctly the confounding factors. And, well, this is just an image from the Phenol Explorer, the one that before was nominated. It's a database, European database of polyphenols, because the research in polyphenols is spreading in these last years, and there are some polyphenols that are specifically present in beer or wine or whatever, so they should be taken into account as possible, let's say, for having a health effect. Well, what's next? This was a pilot study, so our goal now is to collect more data and not just focusing on nutrition, but also on lifestyles. Because I think that the main focus of the research on alcohol is not even about creating non-alcoholic beverages, but it's about the education of the consumption, moderate consumption, daily consumption, that naturally occur in some places, for example in Sicily, in which people generally, as we said, have the drinks with the meal, whatever it's wine or beer, now they are going together. And it's part of the meal as considering the beverages as a part of the meal itself. Well, thank you.